Hello everyone, in this video we will see the difference between direct inguinal hernia and indirect inguinal hernia. Now anatomically, the direct inguinal hernia, the swelling protrudes through the Hesselbach triangle which is medial to the inferior epigastric vessels, whereas your indirect inguinal hernia enters through the deep inguinal ring. It trespasses inside the inguinal canal which is lateral to the inferior epigastric vessels. Usually, the cause of direct inguinal hernia is an acquired weakness of the posterior wall of the inguinal canal. Indirect may be due to congenital causes, due to a patent processus vaginalis, due to lifting heavy weights, etc. The incidence of age in direct hernia is seen in older men, which is more than 40 years, whereas indirect is seen in young individuals. Their relation to inferior epigastric vessels, like I said, the direct one is medial and the indirect one is lateral to the inferior epigastric vessels. The relation to the deep inguinal ring, the indirect inguinal hernia passes through the deep inguinal ring inside the inguinal canal, whereas the direct inguinal hernia does not enter the deep inguinal ring. The relation to scrotum, the direct inguinal hernia does not reach the scrotum and it usually stops at the superficial ring. The indirect inguinal hernia will trespass the inguinal canal and may descend further into the scrotum. Cuff impulse is more marked and pronounced in the indirect inguinal hernia. It is present in direct inguinal hernia, however, it is not so well marked. The frequency of seeing these kind of cases, usually we see the indirect ones more commonly and less frequently we see the direct variety. Both direct as well as indirect inguinal hernia are reducible type, and the treatment option for direct inguinal hernia is usually a tension-free hernioplasty, which is the Lichtenstein repair, whereas in indirect inguinal hernia, various options like herniotomy, hernioplasty, herniorrhaphy can be implemented. Now, a quick memory trick to remember, that is your direct inguinal hernia, D stays direct, which means it is medial and it does not go into the deep inguinal ring. It doesn't reach into the scrotum and it does not descend down. The indirect inguinal hernia enters the deep inguinal ring. It runs inside the canal and it reaches the scrotum. So remember, medial to the inferior epigastric vessel is direct inguinal hernia. Lateral to the inferior epigastric vessel is indirect inguinal hernia. See you next time. Bye. Hello everyone. In this video, we will see the difference between direct inguinal hernia and indirect inguinal hernia.